often we'll see somebody who looks like they have one shoulder higher than the other. They go to a tailor. Okay, let's hem this sleeve an inch shorter than the other. But is the reason that you're seeing this because of the shoulders, or are there more things going on below that's going to create this effect? So often, for example, let's say I twisted my right ankle when I was younger. The body brilliantly wants to protect that side of injury, so we'll shift the body weight over to that left side. After a while, though, we're going to overuse the outside of our left leg, so we might develop something like ITB, iliotibial band syndrome. So to protect that left side, what are we going to do? We're going to shift our body weight over to the right. So what am I doing now? I'm hiking up that right hip. I'm bringing down the right shoulder, shifting the weight there. Now the head always wants to be straight, so the head will come over to the left. So it's a whole layer of compensation, especially along the lateral muscles along the side of our body, which can really pull us out of the right position. And when their bones are out of the right position, it could create rubbing in the discs or rubbing in the joints or compression in the discs. So what I'd like us to do is we're going to do a side stretch. You could just do it with your arms at your side, or if you feel comfortable, arm overhead. If you have any back pain or hip issues, I'd say be comfortable with this and maybe just do like a standing tricep stretch, which the connective tissue line is still going to be stretched as well. Lift your chest, shoulder blades just naturally down. So whatever's comfortable for you, and just breathe nice and deeply. And whatever side you're stretching in whatever position, just get a sense as to the nature of that stretch. Inhale, stomach expands. Exhale, let it go back in. Deep, slow breathing. It's kind of counterintuitive. The less hard we try, the more everything's going to release. To really pay attention to the nature of the stretch, because we're going to compare it to the other side. If you feel like you're putting your chin towards your chest, kind of just elongate that. Okay, come up nice and slowly. And whichever stretch you did on one side, please do the same one on the other. And now as we go to the opposite side, I'm bending to my left, just get a sense as to how the stretch feels on the other side and compare it to the first. Like I'm much weaker structurally my right side, so I shift my weight to my left side. So my left is so much tighter than the right. Okay, excellent. So with side bends, with rotational exercises, I find that doing them a second and sometimes even a third time really creates that balance that the body is craving and needs. So we're going to do that one more time. And now let's compare two things. How that same side feels on the second set relative to the first. And if you had a lot more tension on one side than the other, is that becoming any more even like one or 2 percentage points would be huge. So whichever side you did first, let's do that again. Relax, deep breathing. Try to keep even weight on both feet. You're gonna probably want to roll to the outside of your foot. Two more breaths. Excellent. Rest a few seconds. And let's go to the second side. And now let's see if we've created a little more balance from left to right the second time around. Okay, amazing.